If I ask you to think of a transgender person right now, I want you to think about who comes to mind. What do you know about that person? I am guessing that most of you thought about somebody who transitioned after they had gone through puberty, meaning they went through a puberty and then later transitioned to become their true self, possibly going through a second puberty. And I bring this up because that's what most people consider, because that's what most people know, unless you know somebody, have someone in your life who transitioned prior to puberty, or you're a fan or aware of Jazz Jennings, then maybe you thought about her. But aside from that, most people think about those life experiences of those individuals who transition after puberty. And I'm bringing this up because that is why I'm focusing the next few episodes of the podcast on understanding the transition experience for those that transition prior to puberty. Now, if you are a physician who is not a pediatric physician of any sort of specialty, this still pertains to you. I know many of you are probably thinking, well, okay, I deal with adults, but this still pertains to you. In fact, I would say it's most important for you, and here's why. It's important to you because those that transitioned prior to puberty, meaning went through a social transition, and then for those that chose a medical transition and underwent it, they've gone through one puberty. Those first generation of going through that are now adults. In fact, I mentioned Jazz Jennings. She's now 24 years old. She's an adult, but that generation is now hitting 18 and up. So you will start seeing in the next so many years, potentially, depending where you practice, a patient here and there who transitioned prior to puberty. And I think it's important to understand what that social transition entailed, what it meant having a medical transition for those that had already transitioned socially and had the familial support. I mean, if you think about it, in order for a child prior to puberty, so most likely prior to the age of 12, to socially transition, they need adult support because they can't buy their clothes. They can't decide to not cut their hair or to decide to cut their hair, except there are some kids sometimes that will take the scissors to their hair themselves. There's a lot they can't do without an adult, the parent or guardian, supporting that. So they are going into a medical transition already with that support. It looks very different. They're not wondering what's going to happen when I come out. They're already out. And most of the time, they don't remember their life prior to transition because of the age in which they transitioned. So, we're going to talk about what that social transition is, what that medical transition looks like for somebody that's socially transitioned. And then for those that desire a surgical transition, what that entails and what it doesn't entail, and how there might be different medical considerations. So, I want to bring this up because it's something that I don't think we're discussing. When people are getting educated on gender, I think that's amazing and wonderful, but we're not seeing all perspectives. The perspective that's often presented are those that transition after puberty, which is a very important perspective. But this is a different perspective. There are different medical considerations, there's different biological experience, there's different psychological experience. So I think it's important that we talk about it and understand it so that we understand all the perspectives, not just one. And as anything, no two experiences from two people are going to be the same. Even when we share certain identifiers with people, I talk to other women all the time. I talk to other women physicians. I've talked to women physicians who are OBGYN. I've talked to women physicians who are OBGYN of Mexican descent. And yet our experiences are all different, right? So, with that in mind, understand that I'm just going to be discussing some of the commonalities, some of the medical considerations to have as physicians and to understand why and how it might look different than those that transition after puberty. And I want to say that I'm in a lot of spaces where I talk to people that don't consider this perspective, not out of any malintent. They just never thought about it or never realized. Many people don't even know what that transition looks like for those that transition prior to puberty. They don't consider how that might be different going through one puberty instead of two. They don't consider how it might be different for a person that doesn't even remember being treated as anything different than how they identify. So, all these things I think are really important to understand for us to provide the best care we can to patients is understanding how this perspective might be different. And like I said, I find it lacking many times in conversations. And you're not alone. When I go to like conferences like a transgender awareness conference, I was in a meeting and somebody was presenting some medical information on patients that transition post puberty. And I asked, what information is out there for those that transition prior to puberty? And the person didn't know, but somebody else who was a medical provider chimed in, well, there's really not many of those. That's not what's important, I think is what they said. It is important. Yes, they're going to start trickling in, but there's more. There are a lot more patients coming that have this experience. And I think we need to think about it. Even when I talk to researchers, many research designs are wonderful, beautiful designs, but they have in mind those that transition after puberty. And when I ask them, have you considered, are you excluding those that transition prior to puberty, or how are you going to handle that? Because that is going to skew your data. That is a completely different population, a different experience. And, oftentimes they get, "Well, we don't have any of those." But what if you have them? Like, let's think about it ahead of time rather than reacting to it. Let's design. So this is what I mean that oftentimes from research to advocacy, it's not even thought about sometimes. And I work on some committees that look at care disparities for transgender non-binary patients. And many times there are amazing voices there of transgender non-binary patients who transitioned after puberty. And when I bring up some of the issues that those that transitioned prior to puberty have experienced, many people tell me, including transgender and non-binary individuals, I never thought about that. I never considered that. I never thought about how that might be different. So I think it's important we talk about it because all perspectives are important. And many of those, because they're just now becoming adults, that first generation that went through that experience of transitioning prior to puberty and going through one puberty that's in alignment with their identity, they're now just becoming adults. So they have yet to have a seat at the table. They're just starting to be at a point to get a seat at the table, to be able to share that perspective, to be able to share that experience. And I think in medicine, there are things we haven't thought about on how we do things, like why we put sex on ID bracelets, or who should get a pregnancy test? What criteria are we using? And how does it make sense? So these are some of the things that I think we need to think about when we consider and when we add in that perspective, especially again, regardless if you are a pediatric care or adult medicine care provider, you are going to have these patients starting now. First generation are adults. And so I want to start the discussion. So the next few podcasts are going to be talking about that experience of social transition. And for example, it is a very common thing for people to say that those that transition prior to puberty are too young. How do they know they're too young? And yet, those that transition after puberty are said, why did they wait so long? Why are they just saying something now? Why didn't they say something before? Why didn't they have a sign before? So I heard Dr. Joanna Olson Kennedy talk about this, and she referred to it as the transgender paradox. It's true. I've seen it play out talking family after family, talking to providers. It's either too young or why they wait so long. So anyway, things to consider and looking at the kids that transition socially, and then talking in the next episode about a medical transition, but specifically a medical transition for someone who is living as their true self prior to going into that medical transition, having that familial support. And then talking about surgical transition for those that desire, what special considerations there might be, what might look different, and we'll go from there talking about this perspective. Because again, I often hear it missing in many circles and many conversations. So let's get that conversation started in these next few weeks because perspective matters.